Hi, I'm Dr. Maxime Billick, a clinical associate at the University Health Network in Toronto. Today, I'm going to discuss Human Immunodeficiency Virus, generally known as HIV.
Currently, over 65,000 Canadians are living with HIV, and there have been over 20,100 HIV-related deaths in Canada since its discovery in the early 1980s.
HIV is a viral infection. Viral infections are different than bacterial infections, which can usually be treated with antibiotics. There's no cure for HIV. However, there are now excellent treatments that can control the amount of virus in someone's body and prevent the transmission of the virus. We'll get into the treatment options in a little bit. But before we go any further, let's get some facts correct. HIV and AIDS are not the same. HIV is the virus that can lead to AIDS if HIV is not treated. HIV is not a cancer and cannot be transmitted through casual day-to-day contact, such as handshakes, sneezes, sharing drinking glasses, swimming in a pool, or sharing things like water fountains or toilet seats. Anyone can contract HIV. One of the biggest misconceptions is that HIV/AIDS is a gay disease and that only men who have sex with men can contract the virus. This is false. HIV is an infection and does not discriminate against gender, sex, race, ethnic origin, or sexual orientation. HIV is no longer a death sentence. Anyone who does contract HIV and receives timely treatment from a healthcare provider can live a long and full life with a normal life expectancy. And if they take their medications routinely, they will not be able to transmit HIV to others. Recent numbers have indicated an increase in infections, so let's look at some of the specifics in a little more detail. Many viruses target specific parts of the body, such as how the flu virus attacks the respiratory system or how herpes simplex virus causes genital herpes. However, HIV is evasive and can live within the immune system for many years before revealing itself. HIV specifically targets the immune system, infecting and destroying a type of white blood cell called a CD4 T cell, which are crucial for fighting infections. Unlike other viruses that the body can eventually clear, HIV is a master of disguise with several tricks up its sleeve. It can integrate its genetic material into the DNA of immune cells, creating a reservoir of the virus that hides from both the immune system and medical treatments. This ability to remain hidden makes it exceptionally difficult to eradicate. Both the ability to hide and integrate into the human genome, and also because it is hugely genetically variable, are reasons why we don't yet have a vaccine or a cure for HIV. If people who are HIV positive take their medications intermittently or don't take them as prescribed, HIV can mutate or become resistant to treatment. These evasive traits have made HIV a chronic condition and sustained its status as a global pandemic for over 30 years, resulting in over 43 million deaths worldwide. Besides COVID-19, HIV is one of the longest active pandemics in modern history. The HIV virus can only be passed by 5 bodily fluids, which are blood, semen, including pre-ejaculate, rectal fluid, vaginal fluid, and breast milk from infected mothers. Unprotected sex and sharing needles are the top 2 ways HIV is transmitted. HIV can also be transmitted to a fetus or baby during pregnancy, birth, or breastfeeding, by sharing needles for IV drugs, by sharing needles or ink when getting a tattoo, by sharing needles or jewelry when getting a body piercing, by sharing or using contaminated acupuncture needles, or by getting a blood transfusion in parts of the world that do not routinely check for HIV. While these methods of passing the HIV virus are specific in nature, anyone can still contract the virus by any of these transmission types. In the 1980s, there were some reports of transmission by blood transfusions, and that can still happen in certain parts of the world. In Canada, the US, and Western Europe, there is a closely monitored blood supply, and it's tested often. The risk of getting HIV from a blood transfusion in Canada today is virtually zero. Anyone can be infected by HIV. However, certain populations in Canada are disproportionately impacted by HIV and are at a higher risk of being infected with the virus. These include men who have sex with men, African, Caribbean, and Black communities, people who use injection drugs, Indigenous communities, prisoners in Canada, people who exchange sex for money, food, or drugs. Within these at-risk groups,
39% of new HIV infections were from heterosexual contact. 36% were from male-to-male sexual contact. 18% were from injection drug use. And 4% were from male-to-male sexual contact and injection drug use.
This crucial data shows us that everyone in Canada can be vulnerable regardless of gender, sex, race, ethnic origin, or sexual orientation. Recognizing the symptoms of HIV early can be crucial for timely management and treatment. In the initial stages, HIV symptoms can resemble those of the flu. These can include fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. These symptoms typically appear within 2 to 4 weeks after exposure and may last for a few days to several weeks. This stage is known as acute HIV infection and is often missed because it gets better without treatment. After the initial symptoms have resolved, HIV may not cause any noticeable signs for many years. This period is known as the clinical latency stage or chronic HIV. During this time, the virus is still active but reproduces at low levels, and people may not feel sick or have any symptoms at all. If left untreated, HIV can progress to AIDS. Symptoms of AIDS can include weight loss, recurring fevers or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands in the armpits, groin, or neck, diarrhea that lasts for more than a week, sores of the mouth, anus, or genitals, pneumonia, a very sore throat or white paste on the tongue or cheeks, red, brown, pink, or purplish blotches on or under the skin or inside the mouth, nose, or eyelids, or memory loss, depression, and other neurologic disorders. It's important to remember that these symptoms can easily be related to other illnesses. The only way to know if you have HIV is to get tested. If you have experienced these symptoms and think you might have been exposed to HIV, consult your healthcare provider immediately. Early diagnosis and treatment will make a significant difference in managing HIV and maintaining a healthy life. Not everyone who has HIV knows their status. Since HIV symptoms can resemble the flu and can live in the body without symptoms for years, people might be HIV positive and not even know it. The only way to know if you have HIV is to get tested. It's important to note that sexually transmitted infections, or STIs, and HIV are not the same and require separate tests. Routine blood tests will miss HIV. A special HIV test needs to be sent. HIV testing is simple and free in Canada and requires regular blood work or a couple of drops of blood for a rapid test if a recent infection is suspected. For sexually active men who have sex with men and those who share needles to inject drugs, routine HIV testing is recommended every 3 months. Everyone should be tested for HIV at least once in their life, if not more often. Talk with your healthcare provider or local sexual health clinic to discuss which HIV test is right for you. Don't forget to get your regular STI screenings too. If you know you have HIV, you can get the treatment and care you need to prevent the disease from progressing further, so you can live a long and healthy life. First, it's important to remember HIV is no longer a death sentence. There have been significant advances in HIV treatments, and with the right care, you can remain healthy long-term, live a full life, and not pass HIV to other people. HIV can be split into 2 different areas: prevention of HIV and treatment of HIV. Within the area of prevention, healthcare providers have more tools and options than ever before to prevent someone who is HIV negative from ever becoming infected with HIV. PrEP. If you are at a higher risk for HIV, you can use a medication to prevent yourself from getting HIV. Pre-exposure prophylaxis, widely known as PrEP, is a medication taken before the person is exposed to HIV, either daily or on demand when they know they might be exposed. It works by blocking HIV's ability to establish an infection in the body. This drug is highly effective when taken as prescribed. It can reduce the risk of getting HIV from sex by about 99% and from injection drug use by at least 74%. It's important to remember that PrEP only helps to prevent HIV and does not prevent STIs such as gonorrhea and syphilis. Even if you're taking PrEP, HIV and STI testing is still required every 3 months. PEP. If you believe you have been exposed to HIV, post-exposure prophylaxis, known as PEP, is the best line of defense to help prevent the transmission of HIV in an HIV-negative person. PEP must be started as soon as possible and within 72 hours after a possible exposure to HIV. Every hour counts. PEP should be used only in emergency situations, and it is not meant for regular use by people who may be exposed to HIV frequently. PEP is also not a substitute for regular HIV prevention methods, such as PrEP or using condoms. If you have been exposed to HIV, contact your doctor, a hospital emergency room, or a sexual health clinic immediately to see if they offer PEP. Recently, there have been newer methods published in the updated WHO guidelines that describe PEP in pocket, or PIP. PIP is a method where PEP is prescribed in advance of an HIV exposure. The prescription is filled and kept in a safe place until it is needed. This way, when there is a risk of exposure, people don't have to run to the emergency department in the middle of the night to get PEP. They can start the medications right away at home and follow up with their healthcare provider in 1 to 2 weeks for testing. If you do test positive for HIV, you will be connected with a healthcare provider who specializes in HIV treatments. You will be encouraged to take daily anti-HIV medications known as antiretroviral therapy, or ART, with the goal of reducing the viral load. ART is generally a combination of 3 or more daily medications. There are now many different single tablet regimens, meaning you would only have to take 1 pill per day. Recently, Health Canada approved once every 2-month injectable medication, reducing the need for daily pill intake. Through ART, it is now possible to stop HIV from reproducing in an HIV-positive person, which reduces the amount of HIV in the body, known as the viral load. Using medication, viral loads can be reduced to levels so low that they are undetectable on blood work results. Studies have shown that those on ART with an undetectable viral load cannot transmit the virus to their sexual partners or to other persons, giving rise to the phrase undetectable equals untransmissible, or U equals U. Maintaining undetectable viral loads means the HIV virus does not progress in an HIV-positive person's immune system, prevents the virus from multiplying, and giving the possibility to live a long, healthy life with treatment. The stigma surrounding HIV remains prevalent worldwide, significantly impacting the mental health of those living with or at high risk of HIV. These mental health challenges are often overlooked but are crucial to address. Living with HIV or being part of a high-risk group can lead to various mental health struggles, such as depression and anxiety, substance use disorders, external and internal stigma and discrimination-related stress, social isolation and relationship difficulties, delayed medical care or missed appointments, and can even influence risk behaviors and transmission rates. A strong support system of friends, family, or your chosen family is vital for navigating an HIV diagnosis and treatment. Unfortunately, many individuals affected by HIV lack this crucial support network. Integrating mental health care into HIV treatment plans can be beneficial. Some suggested supports include routine mental health assessments by a licensed professional, psychotherapy, medication for mental health conditions when necessary, peer support groups, stress management and coping skills training. Many communities and provinces across Canada have local HIV support organizations to help with your needs. At UHN, Canada's first and largest HIV clinic was created in 1994 and brings together the most needed HIV services under one roof, provided by a team of medical specialists, nurses, pharmacists, social workers, occupational therapists, and dietitians. You can arrange an individual consultation with any of these healthcare providers at the clinic, and they can also direct you to support groups in your community. The World Health Organization currently estimates that at the end of 2022, over 39 million people across the world were living with HIV. The greatest potential for HIV elimination in Canada and in the world lies in the use of HIV prevention strategies like PrEP and PEP and antiretroviral medications in people living with HIV to decrease viral load and therefore HIV transmission. We have seen huge progress in Canada. In the late 1980s, there was a yearly peak of over 5,000 new HIV infections. That has steadily decreased to about 1,600 new HIV infections in the past few years. However, the newest data shows that since the onset of the COVID-19 pandemic in 2020,
rates of new HIV infections in Canada have increased year over year by nearly 22%. The lowest yearly rate of new infections was in 2020, at just under 1,500 persons newly infected. In 2023, that number had climbed to over 2,400 persons newly infected with HIV. Saskatchewan and Manitoba continue to have the highest rates of new infections in the country.
This increase in the prairies and across Canada may be driven by better testing methods and more people getting tested. However, there are concerns that there's ongoing HIV spread. While there is still much work to be done in Canada to reach no new transmissions, there are emerging new tools to help fight the spread. HIV remains a significant global health pandemic, but it's one we're better equipped to fight than ever before. From groundbreaking treatments to powerful prevention strategies, we've made remarkable progress in the past 40 years. Remember, the fight against HIV isn't just about medicine. It's about compassion, education, and breaking down the barriers of stigma. Whether you're living with HIV, supporting someone who is, or simply wanting to make a difference, remember, knowledge is power and empathy is key. If you fall within an at-risk part of the Canadian population, or if you've just never been tested before, get tested for HIV today. Make an appointment with your healthcare provider or one of the many sexual health clinics at your local health unit and know your status. Subscribe for more informative health-related content from Canada's #1 hospital. I'm Dr. Maxime Billick, a clinical associate at the University Health Network in Toronto. Thank you for watching.